It's great to be part of your life, being a global leader for you and an expert to help guide you through some really rough seas at times for you if you're dealing with bulging discs or herniated discs and spinal pain as a result of that, or spinal stenosis. So I want to become a resource for you that you can always come to learn as much as you possibly can so you feel empowered to make the best choices for yourself, learn about non-surgical approaches to management of bulging and herniated discs and how you can do that from the comfort of your home. So what I want to talk about today, and let me switch over here. So if you are joining us, please say hello. I just let you know, sometimes on Facebook and YouTube, if you try to do it, if you don't see me saying hi or responding back to you, reload it again. Unfortunately, it's technology and just doesn't always work perfectly. So if you say hi to me or if you got a question and I'm not responding to you, it's because I can't see it. So just if you would just refresh your browser again and reload either your Facebook or your YouTube to be on here, and then I can answer your questions for you. So what do we want to talk about today for a few minutes? I want to talk to you about one of the vehicles that a lot of people are offered when it comes to management of bulging or herniated discs and obviously trying to reduce that pain, and that is a microdiscectomy. So if you've ever heard of a microdiscectomy, let me know. If you've had a microdiscectomy, let me know as well in your comments. I would love to see that if you want to chat about it. We just had a great live on Instagram, so it's great to be here. So let's talk about microdiscectomies. And so I made up some slides for you here. We've talked about it previously, but so I want to talk about unlocking the truth, understanding their benefits, their risks, and other non-invasive options you have, which I'm not going to talk about today because we've got some really cool stuff coming for you in February. But let's take a look at this for a second. So what is a microdiscectomy? So a microdiscectomy is a surgical procedure. All right, so you got to know that. It's a surgical procedure to remove part of a bulging or herniated disc. Okay, so that's what it does. And it does that by using a tool, and I'll show you a couple other pictures, but you can see right here this instrument. So they're going to puncture your skin, they're going to cut your skin, they're going to move the muscles aside, they're going to bring this instrument into your back, and they're going to be grabbing a hold, and I'll show you a better picture, they're going to be grabbing a hold of that material, all right, that red material. Let's bring you back here so you can see a little bit better. Okay, so remember that jelly, that nuclear material is supposed to stay inside the disc when it comes out like that. Okay, that's a herniation, all right, without getting too complicated about it. And so what they're going to do is they're going to try to go grab that and cut that off so that it's not pushing on that nerve. So in essence, that is what a microdiscectomy is. So let's go back and we'll look at the next slide. So are there pros and cons to it? Yeah, of course there's pros and cons to it. Sorry my face is over the cons, but I can take my face off of there. Look at that, how cool. I crack myself up sometimes. All right, so microdiscectomies, pros. Extruded disc material, so like that red jelly that I just showed you, okay, can be removed relatively immediately. It can offer pain relief. I have seen that in all my years. And healing is usually faster than more invasive surgeries because of the smaller incisions. So you have less of a chance, typically, of infection. Usually the rehabilitation is faster. And I've seen success for people with these. I just want you to know that. But I've also seen these same people injure themselves again and wind up in the same boat. So you need to know that. So I see a lot of times short-term, sometimes relief, but sometimes long-term that disc gets re-injured, and I'm going to show you why that happens, okay? So let me get my mug off of here, and let's look at the cons. So cons is it's an invasive surgical procedure. At the end of the day, it is surgery. And I always tell my patients, I learned this from one of my coaches, is the difference between a minor surgery and a major surgery, especially when it comes to the back, is that only other people have minor surgeries. Usually surgeries become major issues for almost everybody that gets them, especially when it comes to the spine. So you want to be careful, all right? And I want you to know that you do have other options to manage this, and I'll show you that. You can also get nerve root damage, all right? Not what you want. Why? Because that can lead to bowel and bladder incontinence. What's that mean? That means you can't pee or poop, control your urine, or you're having bowel movements. That's not what you want, and that can happen by going in and doing these. So you got to really be careful about sometimes the vehicles that you're using to try to manage this. And I know you just want to feel better. I get it, but I'm going to show you great options. You can also get infection from it, and a disc that is still in a diseased state, and I'm going to show you that on an MRI, okay? So just a little different view. Again, here is the nuclear material, all this material in here. That is the jelly that's inside the disc that's supposed to be contained. These outer rings that you see right here, called the annular fibers, they're supposed to be nice and strong so that they basically create belts that wrap around that jelly so that jelly can't come out. But when these discs become dehydrated or they get damaged, that jelly can squirt out of here like this, okay? And that's what this is right here. So that is that nuclear jelly. And what are they going to do with a tool? They're going to want to go in and snip that off. And so here's a different view of that, where again, so this is your muscles. They're going to push the muscles apart like a retractor. They're going to insert this instrument right here. And they're going to snip. There's a little scissors, very sharp scissors at the end, and then there's a vacuum that's going to, like a straw, it's going to suck that jelly back out of where it's putting pressure on the nerve. And if all things go well, the patient feels better. Short term, okay? So that's what's happening inside your body, all right? And if you got any questions or comments about this, let me know. Would love to share information with you. Here's a kind of another cooler, different view of this. And again, you have this piece of equipment right here that is being inserted through your body. They're pushing the spinal cord away. So this is called the thecal sac that you're seeing, or I'm drawing right here in red. The thecal sac is where your cerebral spinal fluid flows through. It also sits around your spinal cord to protect your spinal cord. This is one of your nerve branches right here. And then the other one right here. And then here you can see a cross-cut of your major spinal nerves that are going out down to your body. Arms, hands, and fingers if it's in your neck. Buttocks, legs, and feet if it's in your low back. And if you see all these little pieces that you're seeing kind of coming down here like that, those are called traversing nerve roots. Those are the nerve roots that you can also see on this model. Try to make sure it's in focus for you here. So if you look at this, you're going to see a whole bunch, a lot of little dots. And let's see if my other camera will work here for you. Yeah, I think we're in biz. And yeah, I see this. These cool cameras I have. Ah, that's a great shot. Everybody like that one? All right, so what you're looking at right here is, see all these little, it's so hard to do it backwards. You see all these little pieces right there? Those are what's called traversing nerve roots, all right? And that's what travels down your spinal cord. And every level, you get one, and then branches off into one of the nerve branches right here, and then one to the other side, all right? So those are called traversing nerve roots. And that's what you're seeing right where all these little red dots are, just so you feel a little bit more informed about your body, okay? So let's talk about microdiscectomy costs, because this is an important thing that you need to use to see if you want to get into this vehicle to try to help you get to the destination that you want to be. How much does it cost? Well, according to costhelper.com, that's where I got this information at, the average microdiscectomy cost is between $20,000 and $50,000. That's a pretty good amount of money if you ask me. Why is that important to know those costs? Well, first of all, it's a lot of money. It's less expensive than a laminectomy or a fusion or a artificial disc, because those surgeries are going to go up sometimes If you get a laminectomy, you're looking at $50,000 on average. If you start going into fusions, you're going to be looking at probably $150,000 plus per level, and every level is about another $50,000. So as I was talking before, I had a patient that had 5 levels of artificial discs and fusions, and by the time they got done with that back surgery, that was a $575,000 surgery. Okay, that he probably could have managed by himself if he would have done what I told him to do, but he didn't want to put the work into it, so now he's got rods and artificial discs and has a whopping bill that probably comes to him every month. Does insurance cover part of it? Yes, it will, but still, even if you have a 10 or 20% coinsurance and you got a $15,000 or $20,000 deductible, you're at $20,000, and then you got to, what, another $10,000 at least if you got a 20% coinsurance on that. I mean, you know, maybe even 30. I mean, you're at $40,000, $50,000. Get that done, and that's if you're better. And that's not always the case. So it can be pretty lofty paycheck. So I want to show you this because this is really important, because we talked about, let's say you get a microdiscectomy. Let's say that you decide to get into this vehicle because you think it's going to manage your pain. So here's a perfect example. This picture on the left, right here, where I'm drawing this star at, okay, is your pre-MRI. So here you can see the herniated disc. So if you see MRIs, you're familiar with that look right there, I'm sure. Here you can see the disc above is actually very healthy. How do we know it's healthy? Because we can look at the color of it. This is a T2 weighted MRI image. And what that means is, the only way I can remember it, because I grew up in Pennsylvania, so I'm not that smart, but I just got to keep studying and learning everything, is that H2O, the chemical compound for water, has a 2 in it. T2 weighted image means that when there's a T1 and T2 when you look at your MRIs, but when it's on the T2, anything that has high water content is going to show up white or light gray color. So here you can see cerebral spinal fluid. So all this white right here, that's cerebral spinal fluid. Okay, should be a healthy disc, should have fluid in it, should have water and blood supply in it, so it should be a light gray color. But when we get down to this guy, right there, now we got a big problem, right? See how dark and black it is? So what did? They did a microdiscectomy on this person. They cut out this part right here. So they went in, did an incision, cut that out. That part looks pretty decent. I wouldn't say amazing, but better than what it was. Okay, but I want you to look at the color of the disc here. Post-surgical, it looks pretty almost identical to the pre-surgery, which means that you still will have a diseased disc inside your body if you get a microdiscectomy. And diseased discs that are dehydrated, like you're seeing right here, is like an old rubber band that you've had in your junk drawer that's been sitting in the back of the junk drawer for 2 years, and you need a good rubber band. You're like, oh, that's the perfect one. You grab it and you go to stretch it over whatever you're doing, and it breaks and it snaps. And why did it snap? Because it got dehydrated over those years in your junk drawer, and it lost its ability to be elastic. And the discs do the same thing, and that's why microdiscectomies aren't a great option for most people. Yes, they can get rid of pain, but you're going to be setting yourself up for another discectomy or a larger surgery, typically in 3 years. And that's what I've seen with almost every one of the patients that's come to my office that's had microdiscectomies. They usually still have pain, and they usually wind up needing bigger surgeries because the discs are still diseased. Okay? So I just want you to know that if that's your decision making. So I hope this is adding some great information to your repertoire of choices so that you feel empowered, and I'm giving you good tools so that you're not just listening to some surgeon who wants to make a big paycheck, but actually someone that cares about you and wants to help you avoid those pitfalls and be successful. So do you have other options? Yeah, you definitely have other options. Spinal decompression still has the highest success rate of almost anything. We're going to be talking about that in February, so we're not going to talk about it today. That's a study. That is me, so don't worry about that guy. But I want you to see what the ability is of here is a pre-decompression and post-decompression patient here. So if you look at this, here's a herniated disc. Okay, actually bigger than what we just saw on the other slide. This is the axial view right here. Again, that's the herniated disc material. This was 12 weeks after, same person. You can see, remember that disc was all the way out there. Look at the healing that took place in this person without ever cutting them open. Hey Marisa, great to have you here. Thanks. And what's so cool is, look at this. You can't even see the nerve branch coming off over here to their left side. And yes, I know everyone thinks I'm on the right, but here, just when you look at your MRI, there's going to be a marker left and right usually. So it's kind of opposite of where your hand is. It's because you're looking up into your body. But you can see this big massive blob right here of disc material. And now you can actually see their nerve branch coming off to their left side, going down their leg. That's why they had no back pain. That's why they had no sciatica anymore. So that's what we're going to be doing, and that's what we're going to show you. So I hope you feel a little bit more knowledgeable. Well, I hope you feel a lot more knowledgeable about understanding the disc. And one of the vehicles that will probably be offered to you if you wind up going into the medical realm of this, and if you don't want to get cut open, then you may want to consider looking at something like spinal decompression. We're going to be doing our big launch in February, so I hope you're going to be with us for that. And I want you to know that I want you to get back to the quality of life that you deserve to have. And if that's like on our last one, Jen being a dancer again and enjoying her life, to being a mom or a dad, or being able to go back to work and provide for your family and feel like you're contributing again, because I know that can be really tough. If you're a grandmother or a grandfather and who's afraid to pick up their grandbaby because they feel like their legs are going to give out, or they're going to be able to drop their baby, and that's a real thing. I'm just going to let you know. I want you to start feeling confident again that you can heal your nerves and your discs naturally. You can. So I hope you learned some amazing stuff about microdiscectomies, how they work, the pros and cons of them. If they did, hey, please like this video. I work really hard to try to bring you some great content, and if you feel like I've earned your respect in doing this, I hope that you'll like it and you'll share it with other people, and subscribe to our channel as well. We bring stuff to you almost every single day, doing stuff. So it's great to have you here. We'll see you next Wednesday. Leave me a comment if you have questions about this, or if there's anything that I can answer for you. I'd love to do that. Next week, we're going to be talking about a different vehicle that's going to typically be offered to you as well. So make sure you're here for that. And I want to make sure that you feel knowledgeable to help you decide on which the best direction to go to help you start feeling great again with your back, okay? So I appreciate you so much. Hope you have an amazing day. See you next week.